I'm Dr. Bogdanovic, professor of hematology in Belgrade Medical Faculty, and I'm a member of International CML Foundation and also expert for CML in Serbia.
My name is Jelena Cugurovic. I'm a steering committee member of the CML Association of Serbia, and I'm also a special advisor to the steering committee of the CML Advocates Network. Dr. Bogdanovic, can you tell me what is a generic medicine?
Generic medicine is the same drug as a branded drug, but produced by the different company. That means after a certain number of time, meaning 10 or 12 years after marketing of the certain drug, it becomes, let's say, public property. So that means that other pharmaceutical companies are able to make the same drug in different forms and to market it on the market. Generic medicine is should be completely the same as branded medical. Most of the drugs now we are using in regular clinical practice, drugs for heart, for hypertension, I don't know, antibiotics are generic medicine in general.
And what is in a generic medicine?
Generic medicine should contain, and it must contain the same substance as originator, as branded medical, and we have several levels of confirmation of generics. We have the obligation that the generic substance can enter into market only if generic preparation should provide the same bioequivalence and bioavailability of a drug as the originators. Certain studies should be done by pharmaceutical companies before applying for registration of a generic drug. To a certain extent, provide security to patients that the generic medicine is equivalent to branded medical. The difference may be in forms of a treatment, that means capsules or tablets or soft tablets, or depends. And we are using fillers like sugar, like starch, like talc, like some stabilizers. And this should vary between the producers.
What about the efficacy of the generic medicine?
It should be the same, because before the approval of generics, there are a lot of legal and pharmaceutical levels for testing efficacy of generic drugs. Generic drug should be marketed only if it shows bioequivalence. That means that in a certain number of patients or healthy persons, that drug should provide the same blood level like originator drug or comparison medicine. So therefore, no generic should be marketed without such a test, and that's a part of a legal system.
And can you explain me the difference between generic medicine and substandard drugs?
Oh well, substandard drugs is something completely different from generics. Generics should be manufactured according to very strict rules. In many countries, you have very good control of the generic producers. They have almost the same level of control like manufacturers of the branded drugs. But in some countries, when rules are not so strict and when there is a possibility to have some kind of substandard drugs, there is a big difference, because the main reason is the main substance, drug substance within the drug. In all generics, that amount of drug is the same and it's very controlled. In substandard drugs, it may vary, it may be less or even not present. And in the whole world, there is a lot of problems with substandard drugs and fake drugs, especially drugs produced in smaller countries, in unrecognized companies, and mainly sold on internet.
And me as a patient, how do I know if I'm taking a original drug or a generic drug?
When some drug is marketed for the first time, when we have the branded or originating medicine, we have a lot of information about the drug, and most companies are using their branded names. Many generic drugs have different names according to their manufacturers, but also some companies are deciding to use just simply generic term of compound itself. Nevertheless, you have different packages, you have different pharmaceutical forms, capsules or tablets, but in most legal systems, package of drug should contain the branded name, should contain the compound inside, that means a generic substance inside, and the strength of a drug within the box. Sometimes in some countries, generic medicine should be a little larger than branded medicals.
And when a patient is switched to a generic medicine, or if he or she is taking a generic medicine, what more can we take care about, both patients and doctors?
So patients should note that at first side effects and general behavior with the certain drug, and of course they should be aware that they're regularly taking their medication. Of course, there is a long and very well defined milestones and recommendations for following up the patients, and that milestones and that recommendations are essential in providing safety and evaluation of response of the patients during the treatment.
CML Advocates Network made the declaration in which they state that generic medication should not be changed to a patient in a period less than 1 year and for non-medical reasons. What do you think about that?
I'm very strong on the position that patients should be on the same generic, on the same treatment for at least 1 year, because for that time his doctor, with regular monitoring and regular follow-up, can have a much more better understanding what's going with the patients.
Should patients be afraid of generic drugs?
I think the patients should not be afraid of the generic drugs at all, because they're taking generics in many other medications, much more frequent. For patients with chronic myeloid leukemia, generics proved that they are safe and that they are efficient. That meaning that if you are taking the generics with controlled system, when they have a firm control of pharmaceutical system, you may have a similar drug, less branded drug. But if you're buying a drug on the internet or on small pharmacy, which is not a pharmacy but something as a grocery store, or buying a drug without any papers or many other things, which is very similar to fake or substandard drugs, well, in that case, patient should be aware. But this is not a situation in the countries when we have a good controlling system of pharmaceutical production. So, for the end, as a kind of conclusion of our talk, patients should take their medicine very regularly, trying to be adherent as much as they could. Also, they should note any adverse events or side effects they may experience, and they should discuss that side effects with their doctors. And finally, patients should not be afraid of generic medicines, especially because they are efficient, they are tightly controlled, and in most countries they are controlled by different agencies and different systems, like all pharmaceutical industry.
We all know that changing the drug can cause anxiety in many patients, but we advise you to speak with your doctor and to speak with your support groups in order to get more information about generic drugs. And never forget, you have to be adherent, because good results with your treatment can be done only if you are taking your drugs.